So, hello guys, good morning. Today we are discussing about one of the most important topic in nursing, osteoporosis. In that osteoporosis, we are discussing about that meaning, definition, causes, what are the sign and symptom, how we are identify the osteoporosis, what are the management, how it is management, how it is preventions. Everything we are discussing about that osteoporosis. So first, we are discussing about osteoporosis. So, we want to know what is osteoporosis, what is the meaning of the osteoporosis. Osteoporosis, in that meaning only, that condition we are understanding. In that name only, we are understanding the condition. What do you mean by osteoporosis? In that meaning, also, see that meaning. In that meaning, there is a Greek word. Is the Greek word. The osteoporosis, osteo means bone. Osteo means bone formation. The osteo means bone and spores means hole. That meaning only that osteoporosis means porous bone, but and also is called weak bone, and also we can also called that hole formation in the bone. So we are going to the definition. So first we know that meaning. What do you mean by osteoporosis? The osteoporosis means that hole formation in that hole, but decrease the density and weakness of the bone and hole formation in the bone. It means the osteoporosis. Then we are going to the definition. What is osteoporosis? The osteoporosis is the condition, but abnormal condition, in which decrease the bone density and increase the fragility of the bone is called osteoporosis. So what do you understand? The osteoporosis means decrease that bone density. It means also, if that bone density means the strength of the bone is decreases, and also increase the fragility. If the bone strength and density is decreases, obviously that increase the fragility, that bone fracture, chances of the fracture, it will be increases. So it is the condition, that is osteoporosis. So osteoporosis mean is the condition which is decrease the bone density. If the bone density decreases, as well as that increase the bone fragility, it's called osteoporosis. I hope all are understand what do you mean by osteoporosis. Then we are going to the, so let's coming to the causes. First causes is decrease the parathyroid hormone. So what is the function of parathyroid hormone? The function of the parathyroid hormone is calcium storage. When in the blood the excessive amount of the calcium is present, that excessive amount of the calcium is stored in the bone. That is the function of parathyroid hormone. The next causes is decrease the oxytocin hormone. So what is the function of oxytocin hormone? When that deficiency of amount of calcium in the blood, in that time the restoration of the calcium in the bone, the releasing in the blood to maintaining the calcium level in the blood. That is the function of oxytocin hormone. That oxytocin hormone is main functioning to maintain the calcium level in the blood. The next cause is decrease the estrogen hormone. So what is the function of estrogen? Estrogen is helps to calcium consumption. If the less amount of the estrogen is present in the body, that is breakdown of the calcium consumption, that can be lead to also osteoporosis. So we're coming to the next causes, deficiency of vitamin D. So what is the function of vitamin D? The major function of the vitamin D is calcium consumption. If the less amount of the vitamin D is present in the body, it can't able to do the calcium consumption, so that can be lead to also osteoporosis. The next cause is excessive consumption of alcohol. So how it is cause the osteoporosis? It is also causes the osteoporosis. How? If the person is drinking the excessive amount of alcohol, that alcohol also increasing that cortisol hormone in the body. The alcohol is increasing the cortisol in the body. That cortisol is break down the calcium consumption. That can also lead to the osteoporosis. And also next cause is family history. That family history, also in the previous history, if anyone having that family, anyone having any bone disorder like osteoporosis, osteoarthritis, anything that can be also lead to osteoporosis. Then we are coming to the sign and symptom. So what are the sign and symptom? If the bone is density is decreases, bone is very weak, can't able to work properly also. So what are the sign and symptom showing for the person, for the patient? First sign and symptom is back pain, is mild to severe. If the bone is density is decreases, bone is very weak. So pain, the one of the most important, the major symptom is pain. The first symptom is pain. If the bone is decreasing, the first symptom is coming to pain. Then height loss, because of the osteoporosis only. Decrease the strength of bone. Obviously that if the bone density is strength of the decreases, because only that low calcium consumption in the body, the person body's calcium level is very low, so that calcium is low is that bone density is and strength of decreases. So it is the one of the most important sign. Then weight loss, then fracture may be occur. How is fracture occur? Because if the bone density is decreases, bone strain is decreases, so that can be lead to fracture only. If the bone is very weak, so that may be chances to fracture. We are going to that diagnosis. How you diagnose the osteoporosis? We are coming to the diagnosis, and the first diagnosis is that DEXA. So what is the full form? DEXA is dual energy X-ray absometry. It is the device, it is the one of the medical device to identify the density, strengthening of the bone, to identify the density of the bone. The next diagnosis is X-ray, because of the any fracture, any abnormalities, weakness, how the density of the bone, to identify the X-ray. CT scan also same. CT scan we have do whole body CT scan, any particular part CT scan like spine CT scan can do. And also that blood test. Why the blood test? Because of the only the blood test only we identify the calcium level. The blood test because to identify that, to check the calcium level in the blood. Then we are going to the management. How it is management? What are the treatment to provide for the patient in that condition? If the person is having osteoporosis, so as a nurse, as a doctor, what are the treatment we provide for the patient? The first medical management is hormone replacement therapy, HRT. Hormone replacement therapy means what are the hormone in deficiency in that disease condition? We know that parathyroid hormone, oxytocin hormone, estrogen hormone, that all our hormone is deficiency, that less amount of the present in the patient body. So those are the hormone is less amount of present in the patient body. Those are hormone we replacing for the patient body, because of the to maintain the function, body function. What are the hormone that like estrogen, progesterone, parathyroid hormone, oxytocin hormone, that hormone replacement therapy. That next management is calcium supplementary tablet, because we all know before also we discussing about that, because it is the main causes is deficiency of calcium, the less amount of the calcium present in the body. So obviously the calcium supplementary tablet to provide for the patient. The next management is ibuprofen. Is the one of the medication for relieving the pain. So in that condition, if the bone density decreases, bone fragility, fracture can be occur, so that pain will be mild to severe to seeing the patient face. So by using the ibuprofen, we managing the pain. We are discussing about that nursing management. As a nurse, what do we need to do? First, we have to assess. As a nurse, we have to assess the general condition like vital signs, what kind that BP, temperature, pulse, respiration. We have to assess, and to provide the comfortable position for the patient. Why need to provide the comfortable position for the patient? Because before only we know that in that condition the patient having a severe pain. So obviously you have to provide the comfortable position to the patient. And next, to identify the risks of the problem. So what are the risks, chances, because in that time to mainly chances to the fracture. So identify the risks of the problem to have to assess and pain management, because in that condition the severe pain can be occur the person to have to medically and non-medical therapy by using that patient, by using the medical and non-medical therapy to relieving the pain for the patient. So today the topic is osteoporosis. I hope all are understand.